for the Community Partners Call here at the end of May. My name is Justin Jeffrey. I use he, him pronouns. I'm joined on this call from a couple of my public health staffs, but I would like to give a shout out first to Seeley Caleppo. He's going to be the gentleman that will be helping me throughout this call. If you have any questions, please direct them either to Seeley or to the main chat, where we can help answer those questions as well. A couple things before we get started. We are recording this meeting and we send it out in about a week and a half in a bulletin for folks to go over, along with the various PowerPoints that you will be seeing today. We also offer various live interpretations on this call. We have ASL interpretation. We also have Spanish and Somali. To access the Spanish and Somali, on the bottom of your screen, if you're on a desktop, you'll see what looks like a globe. And if you click that globe, there'll be three languages, English, Spanish, and Somali. Just at the start, we ask that folks please everyone join the English channel. This will allow us to hear the interpreters come in and communicate with us if there's a question. And once we do that, I will have the interpreters come into the room to let us know how to find you. And if you're on a cell phone, you're going to notice three dots at the top right of your screen, and there you will see the interpretation button. And if you click that, please join the English channel so we can hear the interpreters. So with that, I would like to invite someone from the Spanish room to come into the English channel and let folks know how to find you.
Buenas tardes, si necesitan interpretación en español, por favor hagan clic en el globo al pie de la pantalla, escojan la palabra Spanish. Si están en un celular, hay tres punticos en la parte superior derecha de la pantalla y ahí escogen interpretación y escogen el idioma Spanish.
Estamos
Gracias.
aquí en el canal de español. Si por favor pueden hacer clic en el icono del globo y seleccionar español, podrán escuchar toda la llamada en español. De nuevo, el icono del globo, español.
Did you not hear?
We did, Etienne, sorry.
Okay.
We just had both interpreters there come in, so we sandwiched both of those in together.
Sorry, we can't communicate.
Oh, it is A-okay. We got to hear it twice, so it worked out perfectly. And with that, if we could just have someone from the Somali interpretation room, let folks know where to find you.
fadlan haddaad soo galaysiin oo luuqadda aad raadinaysiin waxaa samaynaysaa kombyuterka markaa ku jirtid waxaa caaradinaysaa calaamadda oo kuusan oo ku qoran luuqadaha ku kala qoran yihiin haddaa rabtid ingiriiska af soomaaliga ama isbaanishka ku dhegaysan kartaa haddaa oo mobileka kasoo hadlaysa dhinaca gadaal hoose ayaa fiirinaysaa saddexda dhibac baa taabanaysaa midka luuqadda aad dooratid ayaa galaysaa saasaa kusoo qaybgeli kartaa turjumaanka ku maqashid mahadsanid.
Thank you. And thank you to everyone for facilitating that. All right. So in today's call, we're going to be going over through a couple different parts here. The first part, we're going to be talking about.
Un par de cosas. La primera parte de la que vamos a estar hablando.
And then just one of the Spanish interpreters, if we could just join the Spanish room, Maria. I think we're good now. All right, we're going to do three parts to this call. First part is going to be Mpox. We're going to have a colleague of mine here at Public Health come and share some updates around the Mpox here in King County, or monkeypox. And then we're going to jump into some updates around COVID-19, vaccination rates within the county, talk about updated boosters, talk about any resources since the May 11th declaration. And then we're going to end it with a couple more social determinants of health highlights here in the county. I'm going to talk about fentanyl overdosing, some food access, see what's coming in June with Juneteenth, and as we look forward to Pride Month as well here in King County. So those are some of the highlights coming up in the meeting. And with that, I would like to invite my friend Marielle to join us. And I will put your PowerPoint up here, Marielle. Just give me 1 second. And I had it somewhere, but now it is gone.
If you want, Justin, I can share it because I have it ready to go.
Oh, yeah. Let's do that.
Okay.
Perfect. Thank you, Marielle.
Thank you so much, Justin, and everybody. everybody for the kind invitation to talk about a bit of Mpox today. Just a really quick update with regards to where we find ourselves as a county, but also just as a refresher, since it's been a little bit over a year since we activated to respond to the outbreak last summer, in spring last summer, when the outbreak happened. And so with that, if there are any questions throughout my providing the information, feel free to interrupt and ask. You don't have to wait till the end. But Justin, I cannot see the chat box. So if either you or Celie could please bring the questions to my attention, that would be
Sounds good, Marielle. Thank you.
welcome. And so just as a really quick refresher on how Mpox can spread, and it's usually spread from one person to another through close, often skin-to-skin contact. And what we mean by that, there's a couple of different ways. It could be direct contact with an infectious rash, sore, scab from a person with Mpox. It could be through skin-to-skin contact during intimate contact, such as kissing, cuddling, or sex. It could be contact with objects like fabrics, clothing, bedding, or towels, and surfaces that have been used by someone with Mpox. As well as through respiratory droplets or oral fluids, like saliva, during prolonged face-to-face contact, such as kissing, or face-to-face. And thinking about symptoms, symptoms usually start within 2 to 3 weeks of being exposed to the virus. People who get sick usually develop a painful rash and can have flu-like symptoms such as fever, headaches, swollen lymph nodes, back and muscle aches, as well as exhaustion. The illness typically lasts about 2 to 4 weeks. With it, and from the moment that symptoms start, it could spread until the rash is healed. So that means the scabs have fallen off and a fresh layer of skin has been formed. And the disease can be serious, especially for immunocompromised people, children, and pregnant people. So that is just one thing to also consider with regards to this particular. Where we are now with cases, and so this data is most recent from May 3rd. As you can see, there are 526 cases of Mpox here in King County, with about 18 hospitalizations happening. And then you can see through the diagram there where we were last year. At this month, we were starting to see outbreak, but then by in particular July, we had 200. And as of April 2023, we had 6 cases. So throughout this whole year, even though we're not seeing the same cases that we did last year, we are consistently still seeing cases.
Hey, Marielle, I'm just going to interrupt you for 1 sec. I personally am having a hard time hearing you at, I would say, about 80% of the time. I don't know if there's a way to troubleshoot that.
Sure. Give me 1 second. My apologies for that. My audio is going hit or miss. I'm going to switch to the phone audio. So if you could just bear with me.
Yeah, no worries.
Welcome to Zoom.
And while Marielle is troubleshooting that, we will also be including this Mpox PowerPoint in the follow-up email, which again comes out in about a week and a half. If you are not subscribed to the bulletin that we send, please feel free to drop your email in the chat box or send me or Celia a private message. And it seems maybe Marielle is back now.
Yes. And can you still see my desktop or no?
I can, yeah.
You can. Okay, great. Would you like me to start from the beginning, or were folks able to hear up to this point okay?
I think Yeah, I think if we can just focus on this slide right here, maybe start at the
Okay.
beginning of what we were talking about with this one.
Okay. Sure thing. And again, my apologies for the audio difficulties. And so what I'd like to do is I'm just going to go back one particular slide, and this is just to see the data. So as I was mentioning, what we have seen for case counts in our county overall is 526 cases with 18 hospitalizations. As you could see, since we started with the outbreak last spring, we've continued to see cases of Mpox in King County, not near the numbers that we saw at the peak in July of 2022, but we're still continuing to see them. When we break down the demographics of the cases, we typically are seeing folks between the ages of 18 to 49 who have been infected with Mpox. And on the most number of cases, it's among cisgender men. But you could see that other groups as well, ages as well as genders, have been infected by Mpox. What we see also with sexual orientation is that, again, that the large number of individuals who have come down with Mpox are within the LGBTQ+ community. But what I do want to emphasize is that it is, irrespective of gender, irrespective of age, race, ethnicity, as well as sexual orientation, folks can become infected with Mpox. One thing also when it comes to cases, what we have been seeing is that within our Hispanic or Latinx community, we do see, when we think about percentage of population within King County, we're about 10% of King County population, but we're about 24.3% of cases. And so just to kind of look at the race and ethnicity data here, when we take this into consideration with vaccination trends, we do have, we've been able to deliver over 30,000 doses in King County, with a good majority of them being first doses since last summer. As you could see, when it comes to age group, it matches those of the cases, as well as with sex. But when we look at the race ethnicity data, when we want to go hone in back into the Latinx community, where we saw a little bit over 24% of cases amongst Latinos in King County, only 10% of the community has been vaccinated. And so we are seeing continued gaps with regards to who is infected as well as to who's been vaccinated. And so looking at the criteria with regards to who can currently get vaccinated, thinking again of the data that I just showed, for the vaccine that we do receive, they're part of a federal reserve that we got from the federal government. And so there is, certain limits with the amount of vaccine that, that is available across the country. So we really look at who is most at risk. And so when we look at the criteria, we look at individuals who've had skin-to-skin or other close contact with someone with Mpox. We look for men or transgender individuals who've had sex with men or transgender individuals, as well as individuals of any gender or sexual orientation who engage in commercial and or transactional sex, for example, sex in exchange of money, shelter, food, or goods or other needs. Upon receiving vaccine, if you're eligible, it is a series of 2 doses, and it is important to get the second dose of the vaccine at least 4 weeks after the first dose. You start to build protection in the days or weeks after your first dose, but the vaccine won't have its full effect until approximately 2 weeks after the second dose. So, it's important to remember that this is a 2-dose series and to receive both doses. And again, we remind folks to not try to get the second dose early, as this may result in decreased effectiveness of the vaccine. Mpox vaccine may help to prevent disease or make it less severe. So the CDC does recommend that individuals who get the vaccine within 4 days of being exposed for the best chance of preventing Mpox. If the vaccine is given though within a couple of weeks of exposure, it can still help to reduce the severity of symptoms and though it may not prevent the onset of disease. For locations where you can receive the vaccine, we always remind folks to please contact and check with your healthcare provider. But we do have 2 locations that I can share that where vaccine is provided. The Sexual Health Clinic at Harborview is vaccinating individuals who are eligible for the vaccine. And as you can see, the phone number is there where you can call and check for availability as well as eligibility. As well as many CMAR clinics have the Mpox vaccine available and walk-ins are welcome. And so for more information, we always suggest that folks visit CMAR's Mpox vaccination page. We have more information always on the website as it becomes available. And so we also recommend folks to go to our public health website to look for information. Once I'm done presenting, I will put the link there where folks can go directly. One thing to let and remind folks know is that you should not receive a cost to the vaccine. So neither the vaccine itself nor administration fees should be charged to you. So for clinics that are providing this vaccine, it is through a federal program, and so there is no cost to the person who's receiving the vaccine, so either for the shot or for an administrative fee. Other ways to lower risk is decreasing the number of sex and intimate contact partners. Also, avoiding venues where people can wear minimal clothing or where there's direct skin-to-skin contact. This is one thing that we were seeing and recommending last summer. Events where attendees are fully clothed and not likely to share skin-to-skin contact are safer. However, attendees should be mindful of activities like kissing that might spread Mpox. Condoms may offer partial protection because they help to prevent the skin-to-skin contact, particularly if there are sores or rashes on the genitals or anus. As well as talking to your partner, this is always very important about any new or unexplained sores or rashes on your body or your partner's body, including any rashes on the genitals and anus and other symptoms, and follow up with your provider if you suspect Mpox or have any questions. And with that, my update is complete for today. Justin, thank you, and Celia again for inviting me to provide this really quick update. I'm happy to answer any questions that folks may have, and if not, that is okay too.
For sure. I do have 2 questions. I'm going to go with the one that we directly see in the chat box. So why is this being called Mpox and not its original name, which was monkeypox? Okay.
That's a really great question. So I can't recall if it was towards the latter part of the summer or the fall. There was a decision and conversation, I think it was amongst starting at the World Health Organization, to change the name. Part of it was, I think, just for streamlining. I think there was also, I think, some question with regards to potential for stigma. And so they moved it from monkeypox to Mpox.
Beautiful. And then the second question was a direct question to me, and it was around the age limit or the age requirement. Is it 16 and up or 18 to receive the vaccine?
That is a really good question. I can't recall for sure, but let me double check. And if I can't get the information back in time for this meeting, then I will give it to you, Justin, in order to share out with notes. I think it was
Beautiful.
16, but I want to be able to confirm it.
Okay, awesome. Well, thank you for joining us, Marielle. And if there's any more Mpox questions, I will direct them your way. And we, again, will put this PowerPoint in the follow-up email that folks will receive. But I appreciate you being here.
Thank you so much.
Yeah. All right. We are going to jump back into the other part of our call now. We're going to kind of be touching on all things COVID. I'm going to get my cat jumping on the buffet table. All right. So hopefully folks can see the PowerPoint and it's not on my other screen, but we're going to talk about the COVID testing sites and the closures that came after May 11th. So as you will notice on the screen, you're going to see a list of what used to be our COVID testing sites here in King County. Majority of these did close on March 31st. There's a little bit of a typo there, but as of May 11th, we no longer have testing sites here within King County. testing site locations are now going to be at your healthcare provider, and we are still using over-the-counter or at-home COVID test kits as well. Which leads us into where to get your COVID-19 test. So the at-home test kits are going to be one of the most convenient ways for folks to still test for COVID-19. They're available at all pharmacies, and they have a range of cost, anywhere from $10 to $25 for a box of 1 or 2. Doctors' offices and pharmacies also will still be handing out COVID testing, or being able to give you a PCR test if you go into a healthcare setting as well. So you want to make sure first you check with your health insurance to see what the out-of-pocket costs will be. We know some insurances are covering COVID test kits, but some are not as well. So many healthcare plans offer free and low access to those test kits. And if you are an organization on this call and you need at-home test kits, we still have access to them pretty much until the end of the summer. So we're asking if you can please reach out, to me, Celie, or anyone here at Public Health, or the email that you see on the screen, phpartnerships@kingcounty.gov, and we can send that link over to you so you can have a stock for your organization until the end of the summer. So potential cost for the vaccines. So just a reminder again, as of May 11th, we are starting to now have costs for the COVID-19 vaccines and the COVID-19 antiviral treatments and COVID-19 tests. We will not be seeing any cost anytime, in the short, due to our national supply. But that will run us until the end of summer. And then come summer, we're still waiting to find out what that cost will actually be. So currently the vaccines and antiviral treatments are free, and this is due to the Federal Reserve that we have. We're thinking this is going to last through the summer for COVID-19 treatments, as they will remain available, and it's going to be dependent on the product through the end of the year. So now is a great time, when you're hosting your back to school events or your healthcare events, to still be offering COVID-19 vaccines, as there will be no cost tied to those. This is the same for folks with insurance or without insurance. As these free federal supplies run out is when we're going to start seeing the COVID-19 vaccines and the antiviral treatments shift to the private market. And once they shift to the private market, what are those potential costs going to be? That is still a little bit unknown, but it's going to run similar to getting the annual flu shot. And other routine vaccines that we've come accustomed to taking throughout our lives. So the COVID-19 shots and boosters will have a little bit of a price tag to them, but the shots and boosters for individuals who are under the age of 18, they will remain free, and they will remain free forever. It's through the Washington Childhood Vaccine Program and Children's Health Insurance Plan. And in addition to the costs that will be coming with the COVID-19 vaccine and antiviral treatments, most commercial insurances, Medicaid, Medicare, programs will offer the vaccines free for their members. So if you are insured, there will most likely not be a cost or a very small copay. I think the real focus right now is finding out what that cost will be for those who have no insurance or limited access to insurance, and that question is still not answered. But as we near close, to the lower the lower amount of vaccines that we have towards the end of the summer, we should have an idea of what that potential cost is going to look like. Again, the cost will most likely be similar to the costs that folks have for other vaccines, and it's the same respect for the antiviral drugs. Antiviral treatments for COVID-19 are most likely going to be similar to the costs that folks have for other drugs through their traditional coverage. So the federal government currently is working with vaccine treatment manufacturers to ensure the patient assistance program that provides free access to these products as they're easy to use and broadly accessible. So I'm just going to pause here for a minute. Thank you, Marielle and Seeley, for putting those links in the chat. All right. So I've talked about this now for a couple meetings, but really we want to talk about, your Apple Health, your Medicaid coverage. So some people may need to enroll, and we're going to dive into this here. So the COVID-19 Federal Emergency Declaration, it temporarily prevented anyone from losing their Apple Health Medicaid insurance. So even if their income increased and they were no longer eligible, they were temporarily able to hold on to that. Now, with this order ending this spring, which it did on May 11th, some folks will be required to complete a renewal application to their Apple Health. So in the coming months, currently right now, we are seeing folks who have received this letter. Apple Health users may receive, a letter from the state with renewal instructions, and they need to respond to those instructions by 2 months, so 60 days. And to ensure that you don't lose your Apple Health, we just want to make sure that you are up to date on your mailing address and your email. To do so, you can go to the Washington Health Plan Finder .org, which Seeley dropped in the chat. And this is just to make sure that they have the correct mailing address and email on file. So you will receive, the letter for you to renew, and you're not going to have a lapse in coverage. We have resources here at Public Health for you and your community. So we're working with community partners. We have been for the past couple of weeks, and we are continuing to work with them to conduct outreach and assist with anyone who may be at risk of losing their Apple Health. And we also have public health insurance navigators, and they're available to assist you with information on affordable healthcare options and enrollment. We have a number there as well that you can call, also a web link, which Seeley dropped in the chat box. It's important to note that not everyone who has Apple Health or Medicaid coverage will receive this letter. Folks will receive it, but some folks won't. So if you have Apple Health or you work with individuals who, are on Medicaid, not everyone is going to receive this renewal letter. It is for a small population who will be receiving this. And if you do have any questions, please reach out to the phone number that Seeley just dropped in the chat box, as those public health insurance navigators will be able to assist you. And if you're on this call and you've experienced helping community, or you yourself have received this letter and there is maybe some tips or any questions or anything you want to talk about, please write it in the chat box. That way we can try to find an answer for you. It is Mercedes, so it is going through CHAP. Giselle, a colleague at Public Health, has been working in this program as well around the messaging. So I will be including this in the follow-up email as well, about the Apple Health and the Medicaid coverage, and making sure that folks do not lapse in their coverage. We must have flyers for this. I know we had an email that went out both in English and Spanish. I will try to get a hold of that and funnel it out to the right sources. So I have not personally seen any flyers, but there has to be. And if anyone on this call knows of where those flyers are, if you could please drop them in the chat box, that would be greatly appreciated. All right. So back to kind of the treatments around COVID-19. So we have the COVID-19 antiviral medications, such as Paxlovid. It was purchased by the federal government, and this is going to remain free regardless of insurance until the supplies run out. So same narrative as our COVID-19 vaccines, the boosters. Once that Federal Reserve runs out, we are going to have an out-of-pocket cost for the Paxlovid. It's going to run what we think parallel to the cost of other drugs that folks get on their traditional coverage plans. So a copay for the Paxlovid, and what that out-of-pocket cost is going to be for folks without insurance or limited access to insurance is still unknown at this time. And I know we've been repeating this for a while, but it's always just good as a fresh reminder. Any questions on a couple of those declarations, the Apple Health, before I kind of jump into the numbers here at the county? Nope. All right. So what we've seen for a while now, the general COVID-19 burden is decreasing, has decreased in the US as a whole, and also here in King County. So in the past 7 days, we've had 47 reported cases of COVID here in King County, 5 hospitalizations, and we've had 0 deaths. Our current trends, have dipped, especially from a year ago. And in the past 7 days, you can see the trends, have definitely been decreasing. These can be found on our website. If you go to the King County website and you type in COVID dashboards, they get updated. They used to get updated on a daily basis. I believe now they're updating them once a week. But all the same information and same charts and dashboards that we've had in the past during the height of the pandemic are still operating and still there. And what we always talk about, we want folks to keep in mind, the idea is, if you believe that you have COVID, we want you to get tested. Stay home. If you test yourself at home, we want you to report that test to public health. What folks are doing, they're sick, they are not testing, which means we don't know if they have COVID, so they're not reporting back to public health, and our numbers are a little bit skewed. So what we do, public health receives the data from people who seek testing. It's a little bit hard now. We've closed a lot of our testing sites, but we do still have access with the at-home COVID testing with folks at their different healthcare facilities to still be able to test. Well, when folks, aren't reporting the testing, the case counts become a little bit less reliable, and then we turn to the hospitals and look at the death data for disease burden. So right now, when we turn to the hospitals, we have no deaths, and our case counts for hospitalizations of COVID have been 5 in the past 7 days. So those numbers are looking rather well in comparison to, to where we have been. But it's always still important just to remember that COVID is still there, to keep what we've learned in the past around masking, social distancing, and testing as a prevention moving forward as well. And if you do receive a positive test result, it's always good practice to report that, to the Department of Health. And I have a link for that, which I will include because it just helps with the understanding of where we are at as a county and as a whole federally as well. All right, and then I will stop here for 1 sec. I'm going to pivot back to the MPOX. It looks like it can be administered to children. That's like, did you want to sum that up, Marielle, if that's possible?
Sure. My apologies for the long email. I was able to get feedback from one of our clinical colleagues. So there was a question about the age for the MPOX vaccine. And so there was an emergency use authorization that was activated last year that allowed for the vaccine to be used in children and teenagers under 18. So this means that it can be administered to them. And actually, per the CDC, during this current outbreak, so since last year, children as young as 4 months have been vaccinated after a known exposure. And so children and adolescents can receive it under this emergency use authorization.
Beautiful. Thank you for the update, Marielle. All right, so back to the screen. This chart right here, again, you can find on our dashboards. It's the COVID-19 hospitalizations. And what we're seeing is it's occurring disproportionately in the older age groups. So this is an average 7-day report of the last 28 days. So if you look down on the bottom, you're going to see 80 years or older is where we're seeing the hospitalization rates generally occur. And then as we go down the age bracket, the graphs go down, but 65 to 79 and then 50 to 64. All right. So just a reminder, a key part of our public health intervention around, vaccinations to keep the hospitalizations, the deaths down, and the long COVID down. It is important that we remain, vaccinated. Keep up with our boosters, our primary series, if folks have not got their vaccines yet, and the updated boosters. As we look at the numbers here within King County, so this was pulled from our website yesterday. In the previous meeting that we had, the percentages were down by 0.1%. So now we have bumped those up. So completed the primary series as a whole in King County, we're looking at 85.2% of the population. The number we kind of want to focus on right now is on the right-hand side, which is the up-to-date. So the up-to-date currently is 33.3% of the population. And then as we look as the received the bivalent, the updated booster, we're at 32.7% of the population. Now, a big part of this, as we, come towards the fall is when we're going to start seeing the cost around, the COVID-19 vaccines. So we still are messaging around COVID here at the county. If anyone or any organizations needs any resources, around messaging around, the vaccines or the updated boosters, we do record these calls. You can send them this call, or you can reach out to us, and we have loads of information that we can send as well. We want to get those numbers up a little bit, especially doing so with the Federal Reserve, and before we start seeing that out-of-pocket cost for folks with limited or no insurance. So vaccine preventable infections around COVID-19. So annual boosters will most likely be made available in the fall. This is going to come most likely when we start seeing that cost for the COVID-19 vaccine. And why we typically see vaccines come out in the fall time, like what we call boosters, is this allows for updates based on the circulating variants. So boosters, they just provide that extra immunity protection, especially for those highest at risk for severe disease. What we're most likely going to see come this fall, with a couple variants that we've had, one being the Kraken, will most likely be in the updated booster. And that is probably in the works right now. And we will most likely be put on, a yearly cycle when it comes down to the COVID-19 vaccine. So the bivalent booster, this is the one we've heard about now for quite some time. We did just have an update. I'll get into that in a sec. But what is it? It is, the booster of the original virus and the Omicron variants. So that is, kind of why it is being called the booster. It's taking the original and taking, some of the variants and combining it into a booster to give us immunity. And it is administered with a one shot. And you can have it, 2 months after your most recent COVID-19 vaccine, primary vaccine, or booster. The side effects for the updated bivalent booster is going to be, on par to all the other COVID-19 vaccines that you've received in the past. Folks who had Pfizer or Moderna, you can mix and match. You don't have to stay loyal to the vaccine that you got for your primary series or any vaccine that you got prior. If you got Pfizer, you can get Moderna, so on and so forth. And for that updated booster, children 5 years of age or older can receive the Pfizer updated bivalent booster, and folks who are 6 years of age and older can receive the Moderna one. So, boosters, we talk about these a lot. They maximize your protection. They help protect when your body's protection from the first vaccine weakens over time. We get boosters with common vaccines like tetanus. And, you still may get COVID, but having a booster is a great way to, to prevent getting more sick, to prevent severe illness, to prevent hospitalizations. Folks who have a booster, we're seeing fewer symptoms, we're seeing milder diseases than those who do not have a booster, especially with this updated bivalent booster. They help prevent community spread. They make folks with COVID-19 a little bit less contagious. And when you do get your booster, you're doing the part, to help spread the virus, not only here in the county, but a less borderless society, our neighbors, in Pierce, Snohomish, all around the world as well. That's why it's important for, to still talk about this booster conversation. And then the updated boosters. So folks might have been hearing that there's a new guideline to the updated bivalent booster. This isn't the slide. One sec. All right. So the new updated bivalent booster, which we kind of just went over, they have a new eligibility. So for folks, they're now able to receive a second bivalent booster. So for many individuals, you were able to receive, the first updated bivalent booster. But if you're immunocompromised, if you're over the age of 65, you're now actually able to get, that updated bivalent booster twice. So if you are over the age of 65, you are immunocompromised and you've already had the updated bivalent booster, let's say 2 months ago, 3 months ago, you're now able to get it again. This is a new update as of a month ago. We kind of just wanted to highlight that for folks as well. So for individuals, again, who are immunocompromised, 65, age 65 or older, if you've had the new updated bivalent booster, you are eligible to get a second updated bivalent booster if you fall into this criteria. All right, just went back a couple slides here, and I want to talk about, the ingredients in the updated COVID-19 booster. So the Moderna and Pfizer updated booster, they use the same ingredients as the COVID-19 vaccines with the change to one of their proteins. And this change, is a specific target to the Omicron variants. And this is pretty common in a lot of the boosters that we see throughout the vaccine world. So just one change, and that is a protein which targets the Omicron booster. And we will see this again as we move into, the fall when we have a new COVID-19 booster as well. And I'd be curious to see what that change is and what protein they're using to target what variant. But for right now, in the updated booster, the protein used is the one that targets the Omicron variant. Any questions? About anything? Feel free to utilize the chat too, folks. I see that Celie, you have dropped a couple brochures there as well. So the brochures that Celie dropped is going to cover the Apple Health re-enrollment for folks via the chat. So I appreciate you, Celie, for doing that. Again, if folks are maybe on their phone, they're not able to download those, we will definitely be including that in our follow-up email as well. All right, so we just went over this. Again, this is about the CDC's new recommendations to allow an additional updated bivalent booster for folks over 65 and those who are immunocompromised. There's a lot of text on this slide right here, but it's always good that we send this out and then you have it as a resource for your community, or if you want to, host your own meetings or send this out to your folks that you work with. I'm not going to go over this one because we kind of just talked about it, but I do want to talk about, why we have COVID variants. We touched upon this a little bit. We talk about this every meeting that we have, but viruses are always changing. So the more a virus spreads, the more it changes. And we're going to be seeing this one for a while here with COVID-19. When a big change happens, the scientists, they call that, a new variant. So some variants are less harmful. We saw that at least here on the West Coast with the Kraken variant, while others are more dangerous. So the Delta, Omicron, we saw, sweeping numbers, especially around, hospitalizations with those variants. So what we are continuously worried about and scientists are concerned about is that with the new variants, they become easier to catch and spread to others, which could then cause, more severe illness. So all this to say, it ties back to just making sure that you and your communities are up to date on those boosters. And I can't stress enough that with the declaration ending on May 11th, messaging right now until the end of summer, it is good, to just let folks know that there will be an out of cost for the COVID vaccine for those folks who have no insurance or limited access to insurance. So right now is a great time to get updated. Definitely get your primary series and any boosters that you may or may not have gotten before we start seeing those costs, and then things get a little hairy sometimes. All right, so we do have questions. How many shots do kids get and what are the common side effects for babies and young children? So children should complete the full series of doses for the vaccine to be effective. With Pfizer, we see 3 doses for children 6 months to 4 years. And Moderna, we see 2 doses for children 6 months to 5 years old. The side effects run very parallel to the side effects folks who are over 5, experience. We got the soreness where they get their shot, irritability, crying, maybe not so much crying when you're a little bit older, but we're seeing the sleepiness, fatigue, the loss of appetite, and just maybe having a very uncomfortable experience in that arm as well. So the less common ones are going to be around the nausea, the vomiting, fever, chills, and your swollen glands. But these are all normal, and it's signs of the body rebuilding. And then the next slide, I believe, excuse me, we're going to dive a little bit more into the childhood COVID-19 vaccines. So are the COVID vaccine doses for children the same as adults? No, they are not. And as you see here, so with the Pfizer vaccine, children under 5, they receive 3 microgram doses, and then the age bracket and the doses go up from there. So 5 to 11, you're receiving 2 10 microgram, children 12 and up get 2 microgram doses, which is the same for the adults. Moderna is a little bit different. So children under 6 receive 2 25 microgram, 6 to 12, we're seeing 50 microgram doses, and then children 12 and up to adults are receiving 2 100 microgram doses. Just some number for context as well, as folks have questions around that. So again, I won't read everything on this slide, but it's basically around staying protected as new variants come up, especially as we get into those summer months and folks are going to be around a lot more people. The best way to protect yourself around new variants, Omicron and COVID in general, is to definitely stay vaccinated and stay up to date. I want you all to assess your risk level as well. If you're around others in an indoor setting, if you yourself are sick, you're feeling under the weather, you may also have COVID, to wear that mask. We have every right to wear that mask, and it is about keeping you and your family and your community safe. So I urge you to do so if you feel that is necessary. And again, avoiding, the poorly ventilated spaces and maintain the physical distancing from others as best as you can. I do see Celie, my friend, you have your hand up.
Oh yeah, I just had a direct question from someone who's just said, how do we know the vaccines are safe for kids? I don't know if you have the answers, but just wanted to ask that question for the community member.
For sure. Yeah. So we've had, I think since, kids have become eligible, it's been around, 2 years now? And prior to that, there was a lot of trials done. I don't necessarily have those statistics or trials that were there, but folks, when we look at folks who received, or children who received the vaccine to children who didn't receive the vaccine is where we saw the greatest numbers of folks with the children with the vaccine, lowest, sickness, lowest hospitalizations, and definitely lowest deaths. And that goes the same with all the trials that were run. So it is definitely shown to be safe and effective with children at preventing COVID-19. And, the vaccines, they were one of the most closely monitored vaccines, I think, in US history. So the FDA, CDC definitely continue to monitor the safety of the vaccines, especially around young children. I don't have access to these files right now, whoever asked that, but if that is something that you would like to see to do your own research, I could definitely point you in the right direction. But good question though. Do we have any other questions around any boosters for adults or children before we kind of move on to part 2, which is some general public health updates? All right, so I will keep moving. I do think it's important that we take a moment to talk about fentanyl, especially here in King County. So fentanyl is a potent synthetic opioid drug. It is approved by the Food and Drug Administration for use as a pain relief and anesthetic. It is approximately 100 times more potent than morphine and 50 times more potent than heroin, as a word that I cannot pronounce. It's potent, and it is here in King County, and we're going to show you some numbers and some resources that we would like to share as well. So drug-related death investigations account for approximately 35% of the King County Medical Examiner's Office death investigation caseload. So 507 deaths have been certified as fatal drug overdoses in King County, Washington this year alone, so in 2023. We typically see fentanyl in 2 forms. So one is going to be a pill form, generally a 100 milligram pill that contains 1 to 3% fentanyl. The remainder is going to contain, acetaminophen. And the second form that we see it in is in a powder or a rock. And the fentanyl, and these percentages vary between, 8.5 to 37 or 38%. So the preferred method of use when we continue, or what we continue to see here in the data, if smoking it, is 49% of the known use in the fatal population. So they also see snorted fatal methods as well. So if we look at the numbers by year, so the fatal overdoses by all drugs, if we look there on the far right, we have 2023 with 507. Beside it, obviously, is 22, and then we go down to all the way to 2016. So we peaked, excuse me, one of the highest years ever was last year in 2022 with 115 overdose deaths here in the county. We are not even halfway through the year right now, and we are set to beat our highest ever, which was last year, because currently we are at 507 overdose deaths. The next slide I'm going to show you of those overdose deaths, it's a tough word for me, which were fentanyl related. So remember, 507 is the total fatal overdose deaths here in the county. And of those 507, 413 of those deaths have been related to fentanyl. If we go back for a second as well, so we had 1,015 last year in 2022. Of those 1,015, 709 of those were related to fentanyl. We have some resources here available. So the Overdose Prevention and Response, it's a King County website. There's a lot of videos on there Zoom meetings, kind of educational pieces for you and your community to look at. The second one is to find the naloxone near you. It's stopoverdose.org. And this is going to direct you to pharmacies, and there's a mail order as well where you can get naloxone for free. There is a standing order within King County for individuals to walk in, pay $0 out of cost to get naloxone. And if you're not sure what naloxone is, it is a little device that folks use to help combat overdoses, especially around fentanyl. So what folks would do is we'll put it in the nose. An opioid fits in a receptor, like a key in a lock. If too many receptors are bound, an overdose occurs, slowing a person's breathing. Once we put the naloxone in there, it actually knocks that opioid out of the receptor and forms a stronger bond for a short time, reversing the overdose. At this point, the person can breathe again, and then that will allow, a 911 call to be had and paramedics to arrive and to kind of take over. And the final link on there is for Pathways program, which reduces illicit opioid use and improves the quality of life, which is a public health insider blog, again, talking about our fentanyl crisis here in the county. We have many resources at our hand that we can help get to community. There's a lot of posters online as well for individuals if you would like posters. So feel free to reach out if you have any questions or concerns. And if there are any questions now, I would gladly take those before we jump into the next subject. All right, so there should have been something that said part 3, but I want to talk about what's next coming in June. So Juneteenth. Juneteenth is right around the corner, and it's honoring, it's an important way to commemorate the emancipation of enslaved African Americans and celebrate their freedom. Juneteenth, also known as Freedom Day or Emancipation Day, is observed on June 19th each year here in the United States. So it's not only a day of celebration, but also a reminder of the ongoing fight for racial equity and social justice. By honoring Juneteenth, you contribute to the larger conversation and collective efforts towards a more inclusive and equitable society. We have a couple events. Well, there was my part 3. We have a couple events that are happening here locally. So from June 17th to June 19th. And I do implore people or individuals, if you or your organization is hosting an event that you do not see on this PowerPoint, definitely reach out and we can uplift that event moving forward for the June 19th celebrations. Definitely more to come. I think our next meeting will be shortly after Juneteenth. But if you, like I said, have anything going on in your community that we can uplift, please don't hesitate to reach out or put it in the chat box and we can get that to the appropriate people. So lots coming towards the end of June. We also are recognizing Pride Month here. Recognizing and supporting Pride Month is a wonderful way of showing our solidarity with the LGBTQ+ community. We're celebrating their identities, experiences, contributions, and it is observed every year in June. So we're remembering the Stonewall Riots, which took place in 1969, and that was one of the most pivotal moments in the fight for the LGBTQ+ rights. Celia, my brother, I see your hand.
Oh yeah, just wanted to correct one of the dates on there. The skate party is actually on June 19th, not the 18th.
Oh, good man.
Yep. Yeah, thank you, Devon, for letting us know. But
Yeah,
we'll make that change, and then when we send out the updated email, it'll be in there. Thank you, Devon.
Yeah, and Devon, I didn't know you were here as well. I don't know if there's anything else that I'm missing, or if you would like to talk on anything else around Juneteenth and maybe what's coming.
Oh, there's a ton of them happening. So I shared some with the Office of Equity and Community Partnerships earlier today. I can drop those in the chat. They may be a little bit duplicative, but I think some of them are beyond what you have listed here. So I can do that just in just a moment.
Okay, beautiful. And then I'll link up with you as well when I send out this follow-up email, and we can put that in the bulletin. So appreciate you, Devon. Yep.
Yep.
So back to the Pride side of things. So we have a couple local events as well. And again, the same messaging, if you or your organization is hosting a Pride event that you do not see on the screen, please don't hesitate to reach out so we can get that event uplifted and showcased, especially within this PowerPoint and also in the follow-up email as well. Other resources around Pride, there's a list here. I do want to focus on the last one, which is the refugee restrooms. So this is a web link, and it's a web application that seeks to provide, safe restroom access for transgender, intersex, and gender non-conforming individuals. There is a whole list within the county that folks can find restrooms to feel a little bit more safer out there. So Celia is dropping a bunch of links from this PowerPoint. So I appreciate you for doing that, Celia. And then we have this on our last PowerPoint as well. So the food insecurity in King County remains high. So how to help and get food access. There is a bunch of resources enlisted on this PowerPoint that you will have when you receive it. I won't go through all of them, but tons of locations. Skip that one. And that leads us to our next meeting. So June 28th, we will see folks back here. The following meeting after that is July 26th. I see we have Joyce, our CAP Reach group, will also be tabling on June 19th. I will send an update. So thank you for that, Joyce. Devon put a couple more dates in there. Appreciate that. Excuse me. So with that, everyone, is there any questions before we kind of wrap up this Wednesday? Well, hearing and seeing none, I want to give a big shout out to all the interpretation, the ASL interpreters, the Somali and the Spanish. Thank you all for joining here. I want to thank all my colleagues from Public Health who were on this call as well that helped me, and thanking you all for being here. And we will see folks again on June 28th from 3:30 to around 4:45 p.m. Thanks, everyone. Have a good rest of your evening. Thank you, Travis. Thank you, Antonio.
Thank you, Justin. Justin,
Yep.
will we get a copy of the slides?
Yeah, are you set up to
Can I get a
receive
copy?
are you, yeah, do you get our bulletins that we send out bi-weekly?
Is it going to be in there?
It is, yeah. If you get the bulletin, there'll be a picture of a little PowerPoint, and then it's included right in that.
Oh, great. Okay. Then I won't worry about copying everything.
Yeah. But I'll send it to you. I'll send it to you tomorrow, just so you have it before. But
Okay.
it is in those bulletins.
Okay. Appreciate it. Thank you.
Yep. Thank you, Mashida. Thank you, Haji. Thank you, Etienne. Thank you,
Thank you.
Maria. All right. I'm going to end this for everyone.